There are so many different treatment options for dry eyes, and that's why we're here back at Clear Eyes and Aesthetics with Dr. Carly Rose to talk about some of those options. So let's start with knowing when you need to come in and get a treatment. When do those symptoms kind of progress to the level where you should be looking into that?
You know, a lot of people ask me this question, and it is very individualized. It's patient to patient. So always, I would say, make sure you're getting your annual eye exams. Your eye doctor will help tell you when is a good time for in-office treatments. And then I would also say anything that is chronic. If you've been dealing with symptoms for a long time, there's no need anymore. We have tons of treatment options available. And so there's no need to wait and suffer. You can certainly come in at any time. Most of our treatment options are also great preventative options. So we even have a few patients that want to get ahead of things with early symptoms. So it's very patient to patient dependent, and always, if you're uncertain, talk with your eye care provider.
Right, just ask. That's probably the most important part.
Right.
And when we talk about some of the treatment options, what comes to mind for me right away, what I have been looking into a little bit myself, is the IPL treatment. Tell me about that.
IPL was a game changer in the dry eye world. So I was treating dry eye for years, and then IPL came to the scene, and that's when we really started treating dry eye, is how I feel. IPL came from the skin world. It stands for intense pulse light, and it was foundationally discovered for rosaceas and age spots, reds and browns. And it was a happy accident that we discovered around over 20 years ago now that it can also help treat dry eye disease.
Wow.
It's been a fascinating journey. There's a lot of skin and eye crossover, and that is one way that we were able to capitalize on another technology and use it for this disease process.
So IPL is a really popular treatment. Tell me about some of the other ones. Thermal, I don't even know if I'm calling it the right thing. Thermal treatment?
That is
right?
perfect. So
okay.
There's this bucket of thermal treatment options. So when we say thermal, it just means heat, right? We have 60 to 80 oil glands per eye in our upper and lower eyelids. And a bulk portion of dry eye disease is an oil gland deficiency. And those oil glands get clogged. And if you think of this like cooking oil, the hotter you get the oil, the more liquid it becomes. And our goal, kind of like plumbing, we want to get the clogs out so that your body can start functioning normally. So when we say thermals, it means heat and pressure to express those glands open. And here at Clear Eyes and Aesthetics, we have a variety of options, again, patient dependent, including iLux, LipiFlow, and radiofrequency.
Okay, I'm like, I don't even know what those mean, but that sounds something, for me, somebody who gets these chronic chalazion.
Yes.
Okay, we're gonna go with
Perfect.
But yeah, clearing out those oil glands, it's really important for people. So are there any other treatments that we should know about, or those kind of the main ones? That
those are the
for?
most common, for sure, but we also have some lid margin debridements. Think of that like an eyelid facial. We can get all kinds of buildup and something called Demodex, which is a parasite in our lashes, so we want to clean those out. And then we also do a few other things. One that is becoming very popular is something called masking probing, where we go in and probe those oil glands we just discussed open. So those can develop scar tissue and fibrosis, and if that's the case, we need to get that out of there.
There we go. So many different treatment options. So come in, learn more about these at Clear Eyes and Aesthetics.
Yeah, and see what's right for you, right? It's a customized treatment plan. There's not a one-size-fits all in this disease process.
Many different approaches. So if people want to get started with that process, what's the best way for them to get connected with you, maybe book that first appointment?
We're very easy to find and get a hold of. You can call, text, email. We have online scheduling platforms. We have social media. So we're almost hard to miss. So whatever is easiest, text, call, and online are usually easiest.
There we go. Well, thank you so much, Dr. Rose.
Thank you.